The summers have just begun and the sun god has begun to manifest all its mighty strength. Along with this, also the illnesses that come up during summer have begun. Today we are going to talk about one such illness. Hello and welcome back to #AskDrNamrata, and today we'll be talking about summer diarrheas, which I commonly encounter in my clinical practice these days. So talking about summer diarrheas, these are known as seasonal summer diarrheas. As the name suggests, there is diarrhea, that is loose stools. Also there is crampy abdominal pain, and or there is nausea or vomiting which is accompanied by loose gushing stools. So what is the cause of summer diarrhea? The prime most important cause is eating or drinking contaminated food and water. This generally happens due to high temperature in summer, which causes the food to get spoiled very easily if it is not either stored properly or it is not cooked properly. Another common reason is eating food outside, which may be cooked very early, and by the time you have it, the food has already gone spoiled. Also, sometimes the food outside is not kept covered and there are flies hovering over it, so that can also bring you down with diarrhea. Also, another common cause is if you are going to swim in a pool with contaminated water, even that can get you down with diarrhea. So what are the preventive measures that one can follow to avoid summer diarrheas? I think you all must try and avoid eating outside food or drinks during these summers, especially foods which are liquidy, because water can easily get contaminated. Another thing, you must definitely try and avoid eating raw food. Try avoid eating food that is not cooked properly, especially if you're going to eat non-vegetarian food outside, that is meat. You must see to it that it is cooked properly. Otherwise, if uncooked meat has been consumed, then you're bound to come down with diarrhea. And certain simple measures, like of course washing your hands before and after your meals, and trying to drink boiled water, and avoiding ice which is made out of tap water. Avoiding ice also outside, especially in cold drinks, chilled drinks, that we generally have ice while we drink sugarcane juice or something like this outside. So avoid these things so that you can prevent coming down with diarrhea. And if you are down with diarrhea, see to it that you consume a lot of fluid so that you can replenish the fluid that you have lost. You can consume fluids in the form of soups, you can consume fluid in the form of broths, in the form of juices, and of course plain water, which is always recommended. So talking about homeopathic management, the remedies which I am commonly prescribing these days is arsenic alb when patient is coming up with symptoms like foul smelling stools along with burning and a lot of weakness and prostration. Then there is podophyllum for watery gushing diarrheas with crampy abdominal pains. Then there is Veratrum album, in which post diarrhea there is a lot of weakness and coldness of the extremities. And there are many others like Gambogia, Aloe, Cinchona, Phosphorus. These are the common ones, and these were just a few clinical tips for my fellow homeopathic students. None of the viewers who are watching this video are supposed to buy medicines on their own. So when do you see your physician? Say if you are having blood in your stools and if you are passing a lot of diarrhea, say 5 to 6, without having any stoppage to them, the consistency of diarrhea is very watery, and you are feeling very prostrated, very dehydrated, along with which you also have fever, then you must definitely see your homeopathic physician as soon as possible. I hope this information was resourceful to you, and up till my next video during these summers, stay hydrated and stay fit.